if you collect the Hypericum after flowering and you make a traditional extract, like the liquid extracts we always used to use, there's no hyperforin in it to speak of. And that's why we never had any drug interactions with Hypericum before, St. John's wort before. And it's still true today. If you choose a liquid extract, especially one made in Australia, there's very little hyperforin, and virtually no risk of interaction at all.
Right.
You can also, if you want to use a tablet, you have to ask the manufacturer, what is the level of hyperforin? And sometimes they will know, sometimes they will want to tell you, sometimes maybe not, but you need to ask them. And if you want to be absolutely sure, then you need to have that documented, because then you can give it to any of your patients and there's no risk of drug interaction.
Hello and welcome. Mentoring with Geraldine is a bite-sized practitioner podcast for naturopaths, nutritionists, herbalists, and practitioners. This podcast responds directly to your needs, the needs of the practicing natural therapist. With interviews, herbal discussions, something business and something clinical each week, you'll get the variety you need and enjoy to stay motivated in practice. Hello and welcome to Mentoring with Geraldine and the Bite Size Podcast. And I am so excited because I asked Michael Thompson to come back again and speak to us, and he's here. Yay! So you may remember the previous episode where we talked about kava, but today we did touch on that conversation, Eleutherococcus and Hypericum, but I thought it'd be better if we had two podcasts. And so we're going to talk about those two today. So Michael Thompson is a naturopath and herbalist, and he's based in Hobart, and he's been practicing for the last 35 years. And as I said last time, if you're watching on YouTube, you'll see the book covers, but podcast people, you'll just have to imagine the book covers. And I will make sure that in the show notes, I've got how to get these, not this old one, but this is the new desk reference that's been created this year. So in the show notes, there'll be links to get those and to find your copy and to get to the digital copy. So Michael, thank you so much for coming back. So lovely to have you.
Thanks for asking me. I want to show you something, or the listeners, I forgot to show you last time. Hang on, where's my camera? It's up here.
Oh yeah, your kava bowl.
This is my kava bowl. It's got beautiful turtles inside it. So I assume, I haven't been there, so maybe you've seen them, but I assume these are the ceremonial balls that they pass around. But isn't that lovely?
I think they make them in those bowls and then make them in much bigger bowls, and then they pass around small cups.
Oh, this is for drinking, yeah.
Yeah, so it's for creating, that's for making it.
This is an old book, but it's a really nice one because it's from 1983.
Yep.
And there's another one called the British Herbal Compendium, which is more scientific. That's a yellow sort of cover. But this one here was actually based on a survey. So they in the early 80s, they must have gone around to all the herbalists, working herbalists in the UK, and asked them about a list of herbs, what they used it for, and the dosage, and this pharmacopoeia is a result of that survey. So that in itself is quite a nice kind of document because of it reflects the practice at that time. But also it's got some things that are interesting and something to really consider especially for students and young practitioners is you can't trust everything you read or hear. And now, of course, with social media and YouTube is even worse. But even with a document like this is interesting. And so I was just going to read out the indications for Hypericum. So the indication for Hypericum, the indications are excitability, neuralgia, fibrositis, sciatica, and topically for wounds. And the specific indication, that's something that they think is a really important indication for a particular herb. The specific indication is menopausal neurosis, just for the women out there, which obviously is not a word we would use anymore.
No, we'd avoid that one preferably, yes.
I assume that a lot of the herbalists at that time in the 80s were men, possibly, before witches came back and took over. This would be a male-dominated thing, but also males seemed to produce stuff like books in those days as well. They were the authors, even though the women were probably quite well represented in the practice. The men probably dominated the associations and the literature. I'm not sure. Anyway, so these are tiny little monographs, and I've actually copied all the important stuff into the phytotherapy desk reference. So you can see that under indications, there's a specific heading called BHP, the British Herbal Pharmacopoeia, and that's mostly from this book, because I think it's really nice to have that information. But I do leave out a few things that I don't agree with. So my book is also my personal take on things, because the contraindication in the British Herbal Pharmacopoeia of 1983 for Hypericum is depressive states.
Oh. Okay.
And so it's interesting, isn't it?
That's really interesting. I mean, I know we all use things for different things, don't we? I mean, I will always put St. John's in if somebody's got chronic fatigue, more for the envelope virus aspect than for the depression of it. And, the changes and the learnings over the years. So I have my copy of that as well, but my copy isn't in a cover because it went out of print. They never printed it again. So once it was 10 years out of print, you can photocopy it. So I have a photocopied version.
Very good. You can share that maybe. So this brings up, did they not use it because it didn't work, or they just hadn't thought of it, or hadn't, and what's the difference between this menopausal neurosis and depressive states? Why use it for anxiety? I guess neurosis is some kind of anxiety. I don't know what neurosis really is, but I guess it's anxiety. And it was when I studied herbal medicine, which was around this time, Hypericum was a nervine tonic. That was the traditional term, and still is. I still call it a nervine tonic because I think it broadens the indication. So students and young practitioners should not think of Hypericum for being only for depression. Like you mentioned, it's also antiviral against certain types of viruses with the envelope. I guess it destroys the envelope and therefore destroys the virus. And so nervine tonic is, broadens the indications for this herb. I think you can use it for somebody who is stressed, who maybe feels fragile, or however you want to interpret the word or the indication in nervine tonic. It could also be that some of their preparations were not great, because at that time they did have fluid extracts versus tinctures, and tinctures were typically a 1 in 5, where you would where 1 kilogram of the dried herb would make 5 liters of the tincture, and they were very gentle kind of extracts. But they also wanted to have stronger ones, so they made 1 in 1s. But in those days, they didn't have much. They didn't have good technology, so they would have to evaporate the water and ethanol off by boiling it, and that can obviously damage some of the active constituents. So you'll find here when you look at some of the dosages, that the dosage for a 1 in 1 fluid extract, they call them, was higher than the tincture extract, which doesn't make any sense because ostensibly it ought to be 2 or 3 or 4 or 5 times stronger, but maybe the boiling damaged it. So in those days, the tinctures might have been better than the fluid extract. So the whole dosage thing is a difficult thing in herbal medicine, because it's so related to the quality of the extract. So that was just a bit about Hypericum, about that. And then
I was just going to say, before we move on, about the boiling. So these would have been people who've been practicing for 20 or 30 years, and they would have been told as well that it was a higher or therefore lower dose with what is ultimately a decoction with the boiling. But the water quality would have been poorer as well up until the 70s or 80s when, all water started to be filtered. So the water standard originally would have been worse as well. So when we're looking back on this traditional, information, we've got to think, well, what was the water standard like? What were they?
They would have had distilled water, but maybe not in herbal medicine manufacturing. Who knows?
Yeah, who knows what they were using? So, but I mean, that's just another layer, isn't it, into this traditional use of herbs and how they were making them and what they were doing.
Absolutely. There's also another example in that same book where they mention stone root, Colossonian, being used for kidney stones, but that's not correct. It was called stone root because I'm not sure it's mentioned here or it's something that came out of herbal medicine, that stone root was good for kidney stones, but that's actually just going, stone root must be good for kidney stones. But in fact, it's stone root because the root is extraordinarily hard. It's as hard as a stone. And that's the reason for that.
Totally different. Totally different.
So be careful with traditional information. Get it verified by science when we can. I love this idea. And this is what phytotherapy is about, really. It's more commonly used in Germany than here, but phytotherapy means, to me, respect for the tradition. And then Germans do have that respect normally, and then apply the science and come up with a better product, basically, more reliable, safer, and so on. Anyway, the other story about Hypericum is that I was also around, and I forget when that was, would have been late 90s maybe, where the Hypericum drug interactions came out. And they came out of nowhere because we've used them for decades beforehand. And we only had at that time liquid extracts. And again, it came out of Germany. And there was these rotten German companies who wanted to, they make great extracts, and they are entirely responsible for all the problems with herb drug interactions concerning Hypericum. Wow. And I'll tell you why. It's because this particular company wanted to differentiate themselves in the marketplace. And the way they do that is to come up with a bit like the Kava cultivar that we discussed last time, something novel, something different. They either come up with a new cultivar or a different species, or they come up with a different extraction or potency, just to make sure that they have something else in the marketplace. And so this company thought, and it's one of Germany's biggest companies, let's find a new constituent. And if we can match that to the antidepressant effects, we can actually come up with a new standardization for Hypericum based on this particular extract constituent, and we'll have something completely different and proven to be our extract, and we'll kill the market, with our extract. So they identified a compound called hyperforin. So we got hypericin, which is the antiviral that you also mentioned last time about its antiviral effect in certain viruses. That's hypericin. Hypericin is also the one that is a photosensitizer that can cause some of the side effects if you're having too much hypericin out in the sun. But it's also used as a treatment of psoriasis as part of a therapy called phytodynamic therapy. Anyway, the compound that they found is called hyperforin, and they went and did a couple of things. They harvested the herb, the Hypericums in John's wort, at a non-traditional time. I think it's harvested after flowering. They did it before flowering, and they also did some steps in the manufacturing to artificially enrich the extract in hyperforin. And then they also did some clinical studies to match that. Their extract was antidepressant, and it is as a whole extract. But then they said it is due to hyperforin, which is not quite true, because even the extracts with no hyperforin and no hypericin still have antidepressive effect. But we now know that hyperforin is almost 100% responsible for the drug interactions. And if you collect the Hypericum after flowering and you make a traditional extract like the liquid extracts we always used to use, there's no hyperforin in it to speak of. And that's why we never had any drug interactions Hypericum before, St. John's wort before. And it's still true today. If you choose a liquid extract, especially one made in Australia, there's very little hyperforin, and virtually no risk of interaction at all.
Right.
You can also, if you want to use a tablet, you have to ask the manufacturer, what is the level of hyperforin? And sometimes they will know, sometimes they will want to tell you, sometimes maybe not, but you need to ask them. And if you want to be absolutely sure, then you need to have that documented, because then you can give it to any of your patients and there's no risk of drug interaction. I know there's one product that's definitely so low in hyperforin that has not been shown in clinical studies with humans that it does not cause drug interactions, and that's the one from Florida's.
Yeah. So and the liquids, because apparently after it's 8 weeks or something, isn't it? And it's all gone from the bottle anyway. And I don't know if there was
any in the first place. Yeah, very little.
I don't know about you, but there's no way we're getting a bottle 8 weeks fresh out of the vat.
No.
Even with shipping and transportation, you're not going to get it at 8 weeks fresh out the vat. So it is a really interesting one, and how things can just go awry because somebody thinks, I'm going to make a buck.
Yeah. And I'm going to disregard traditional information.
Yeah.
About when to harvest and which one to harvest and so on. Yeah.
That's right. It's like all the multi-level marketing stuff, let's ingest essential oils, which is of course illegal in Australia. Highly discouraged.
I still would recommend, especially students and new practitioners wondering about what to do, I still would not use it with antidepressants.
No.
just because you get into trouble. I don't think there's much risk of a drug interaction, but it's just not a safe area to do. So it's one or the other. And patients should choose. Either they go pharmaceutical route or they go down and try something else. And also the other thing is that it can take 4 weeks before Hypericum really kicks in as an antidepressant effect, a long time. So just be patient with it, or have a transition period. If they're coming off an antidepressant, it is possible to give Hypericum in that transition period as they reduce medication, but obviously that's done in conjunction with the doctor.
Yes, totally. I mean, there's it interacts with the oral contraceptive pill as well. So we've got to be careful of the one that we give if they're taking the oral contraceptive pill to avoid pregnancy.
Again, although if you choose a liquid extract or the flawless one, it's very, very unlikely. But just in case, you don't want to be responsible,
Yeah. Who wants to
be safe?
I don't need a baby on my doorstep, that's for sure.
No.
But yeah, it's really interesting the way people or companies think to themselves, oh, I'll just do this or I'll just do that. And it ends up messing up an entire group of people, an entire profession, because of the let's make a quick buck. Yeah. So now, what was our other one? We're going to talk about Eleuthero today.
Oh, yeah. Well. Again, it's again about tradition and interpretation, and also how I guess it's like Chinese whispers. So I've got two just very quick comments about that. First of all, three. The first one is the name. We should not call it Sabian ginseng.
Yeah,
it's just a marketing ploy, a bit like Indian ginseng for Ruthenia. Bad names, not traditional. Don't do it. So it should be Eleuthero. That's the decided upon name for it, which is very close. Although it's different writing, the different spelling to the Russian Eleuthero. I'm not sure exactly how they say it, but it's similar to that. And so that is what I would recommend, and that's what I use in my book. Just because we should try to resist the marketing ploys of thinking of a herb like Sabian ginseng, and it's because it's not Panax. It's different. It's not a cheaper version. Anyway, so that's one thing. The second thing is that Hypericum, Eleuthero was we were taught that you couldn't use it in acute infections because, and that goes across all adaptogens generally. Coming out of Chinese medicine, if you are in a full inflammatory state or due to infection, for instance, that could somehow be aggravated by the adaptogens. And I kind of, maybe it goes for Panax ginseng, I'm not quite sure, but maybe that's one to avoid. But Sabian ginseng, for instance, I call it Sabian ginseng, just a habit start. They die. I know. Eleuthero, in Sweden, there's a company called the Swedish Herbal Institute, and they've had an Andrographis compound for a very, very long time, like decades. And nearly all the information about the use of Andrographis for the common cold and acute infections come from their research, and they're sort of world leaders in research around Andrographis and also adaptogens, because they got this wonderful Professor Panossian from Armenia who moved to Sweden and joined them, and he's one of the key researcher, has been for decades on adaptogens generally. But the interesting thing about the product, it's called Kangyang, Kanjang, Kangyang, something like that. Anyway, you'll find it at the Swedish Herbal Institute, and you'll see that the research is actually done by them, a lot of the clinical research. But that product, the Andrographis compound, the Kangyang product, is actually a combination product and contains Andrographis and Sabian ginseng as the two major herbs. So I deduct from that acute infection cannot be a contraindication for Sabian ginseng or Eleuthero.
Yeah.
So that's interesting, and there's no research to suggest you can't use Eleuthero in acute infections. None whatsoever I can find. The second contraindication, which is also wrong, is hypertension. You'll see that in a lot of textbooks of old that you couldn't use Eleuthero for any hypertensive states, and that's also incorrect. And it's a translation error way back from Russian. That's all. We did a whole paper, Matthias mostly. Well, he did a whole article on this, and just misinformation.
How interesting. Just a simple mistranslation has changed what people do and their behaviors towards a herb.
Decades later.
How incredible is that? How incredible is that? I mean, like we were talking in our last episode about the book, the British Pharmacopoeia, and how, their decoctions versus the tinctures and how things change over time. And in this case, we've got a researcher dedicated to looking at andrographis, and he's also obviously using the other herbs as well, and they've made a product that combines the two. So we can say actually there was just probably quite a bit of misinformation right at the beginning, along with changing, saying, oh, it's Siberian ginseng rather than saying it's erythrum. What it is, it's not a ginseng. And so along with all of that, there's been this train of just a few changes, misinformation, just, maybe the person who was translating was actually the PR person.
I think in that case, it was just a misinterpretation or translation. I don't think that was willful. The other examples I gave, there's a couple of German companies, that was willful. So yeah, we got a bit of both. Yeah.
Well, there we go. So it's really interesting. So thank you. That's right. We've got a couple now. We'll have to think of others. We're going to have to find some other things to talk about, I reckon, Michael.
I'm sure we
come
can.
Back again. I'm sure we can. I'm sure we can come back and talk some more about herbs. So, for the Bite Size podcast, I might leave it there today. But thank you so much for coming back to speak to us, Michael. And I'm sure we can both think of other things to talk about, and I can have you back again once we get into maybe the summer months and things are flowering and you can.
Sounds good. I can do with a bit of warmth now.
Yeah, Tasmania. Yeah, we've got sunshine in South Australia, but it's cold. So I'm waiting for some real summer to come as well, which will be really nice. So again, thank you so much for coming, Michael, and I look forward to seeing you next time on the Bite Size podcast.
You're welcome. Thank you.
Thanks so much for joining me today. Don't forget to rate, review, and subscribe to the podcast for the weekly episodes. If you'd like even more support and learning, then the Academy is for you. Here you'll find part 2 of the herbal discussions, more clinical learning, and case studies to support your clients in practice. Bye for now.